Kathleen from Altrincham Physiotherapy, and today I want to talk about some strengthening exercises for the treatment of lateral hip pain. It's important to be able to strengthen the core and the glutes when you're recovering from lateral hip pain. So we're going to start off lying on our back. Have a folded towel or a small cushion underneath your head. Think about switching those deep tummy muscles on and bring your arms down by your side. Have those feet and knees hip width apart. We're going to start off with our shoulder bridge. Now with this one, if you feel it's more comfortable, you can take the towel out from underneath your head. Breath in to prepare, flatten the back and peel up into your shoulder bridge. And you want to just push those knees away slightly so you're getting some stretch through the front of the hip and get those bottom muscles working. When you're coming down, go down from the top to the bottom and back to your start position. So you're looking at doing about 10 shoulder bridge. So breath in to hold at the top and then back down. Peeling those vertebrae off one at a time, placing back down one at a time. And you should feel the glutes working. You don't want to have too much cramping in the hamstrings and those tummy muscles working. Then we'll turn onto our side and think about working the side glutes there, which are really important in the treatment of lateral hip pain. We're looking for the muscle at the back of the hip, just behind that hip bone. You want to have your feet, your bottom and your shoulders all lined up and switch those tummy muscles on and maybe some length through the top hip so there's a gap under the waist. Going to start off keeping the feet together and then taking that top knee up out to the side. You want to feel the muscle at the back of the hip there doing some work, not down the front and not down the side. If you're struggling to isolate it, straighten the legs out slightly. If you're still struggling to isolate it, try putting a pillow between your knees. Maybe we'll do a set of about 10 to 20 clowns. Then, bend those knees a tiny bit. We're going to do a side kick. That's working on the glute max, the one at the back, into extension. You lift that top leg to hip height. You want to fold forward from the hip. Bring that knee parallel to the floor. And then you want to take that leg back through that range of movement, and then the bottom muscle will switch on. So you fold forward, and then you take that leg through that range of movement, extending through the hip there. You don't want too much back extension, but you do want to get a little stretch through the front of the hip. So again, 10 to 15 of those will be nice. Bring that leg back. Once you've done those, we can then work on our lift and lower. So you straighten that leg out. You don't want the leg to come forward. So you've got that lovely straight profile through the hip. You can have your hand down for balance and you want to lift and then you can rotate the heel back round and then come back down. So you're up and down with a straight leg. And again, another 10 to 15 of those. You want to feel it at the back and you do not want to feel it with increased pain at the side. Do one more. Okay, so then I want to do some 4-point kneeling. So 4-point kneeling is a nice position with your hands underneath your shoulders, knees under your hips. Switch those tummy muscles on and keep that nice alignment through the shoulder girdle and the hip. Start off by stretching that leg away. Keep the toe in contact with the floor, that helps to recruit the glutes. Then stretch away and lift and lower, not arching the back, keeping that head position, again, glutes. And then if you feel that you're doing well with that one, slide away, lift the opposite arm away, and then just hold that for 5, 4, 3, 2, 1. So you could do 10 sliding away, then you could do 10 lift and lower, and then you could do a set of 3 with a 5-second hold.